Thank you, chairpersons. Today, I would like to talk about the preventive effect of L-γ-Glutamylethylamide and lower urinary tract dysfunction. Lower urinary tract dysfunction (LUTD) seems to be multifactorial and correlate chronic disease such as diabetes and hypertension. Chronic sympathetic hyperactivity leads to LUTD associated with overactive bladder, but underlying mechanisms remain poorly understood. L-γ-Glutamylethylamide L-theanine is an amino acid analog contained from green tea, which has recently gained attention for its relaxing effect and sympathetic inhibitory effects. So, we investigated whether the habitual ingestion of L-theanine could prevent LUTD associated with chronic sympathetic hyperactivity. The aim of this study is to clarify the preventive effect of L-theanine on lower urinary tract dysfunction associated with chronic sympathetic hyperactivity. This is the study design. We used 12 weeks old spontaneously hypertensive rat, SHR, as a rat model of overactive bladder with chronic sympathetic hyperactivity. SHRs were divided into a SHR water group and SHR theanine group. L-theanine solution was adjusted to 27 microgram per milliliter, which concentration was in commercial tea products. Both groups were given free access to food and drink for 6 weeks. Blood pressure measurement, serum catecholamine measurement, and cystometry were performed, and after that, bladder tissue was harvested for organ bath study, histological examination, and Western blotting. This is the results. Fluid intake, body weight, and bladder wet weight were not significantly different between two groups. The result of blood pressure measurements by tail cuff method were that heart rate, systolic blood pressure, and diastolic blood pressure did not differ significantly between groups, but mean blood pressure in the SHR theanine group was significantly lower than in the SHR water group. Among the serum catecholamine levels, only noradrenaline levels in the SHR theanine group was significantly lower than in the SHR water group. These figures show the typical cystometalogram recordings. Micturition interval and voided volume were significantly higher in the SHR theanine group than in the SHR water group. This is the results of organ bath study. Contractile response to bladder strips to KCl, ATP, electrical field stimulations, and Calpacol were significantly higher in the SHR theanine group than in the SHR water group. Histological change in the bladder muscle layer was assessed by elastical muscle stain. The connective tissue to muscle ratio was significantly lower in the SHR theanine group than in the SHR water group. Histological change of small arteries in the suburothelial layer was assessed by hematocystine and Elgin stain. The median to lumen ratio of suburothelial arterioles was significantly lower in the SHR theanine group than in the SHR water group. To reveal how L-theanine solution protected the lower urinary tract function, we examined immunohistochemistry and Western blotting. Expression of malondialdehyde, MDA, which is non-specific oxidative marker, was significantly decreased in the bladder tissue of SHR-theanine group than in the SHR water group, especially in bladder urothelium. Expression of hypoxia-inducible factor HIF-1 alpha did not differ significantly between groups. Our results suggest that oral administration of L-theanine for 6 weeks might preserve LUTD effectively. Reduced serum noradrenaline level lead to suppressed chronic sympathetic hyperactivity and decreased peripheral vascular resistance. Because the bladder hyperactivity in SHO has been suggested to involve micturition reflex in the brain and spinal cord, suppressed chronic sympathetic hyperactivity might directly contribute to prevent LUTD via suppressed bladder hyperactivity. On the other hand, decreased peripheral vascular resistance might suppress both bladder hyperactivity and impaired bladder contractility via reduced oxidative stress and fibrosis respectively. In conclusion, oral administration of L-theanine in green tea might prevent LUTD caused by chronic sympathetic hyperactivity. Thank you for your attention.